we went from looking at paying a 17.5% increase to actually saving across all funds $900,000. That's not saving over 17.5 million. That's actually 17.5%. That means actually saving over this year $900,000. That's a big improvement for us. Now, that said, the board said, please protect our employees from the downside of this change. And we are committed to doing so. It is very hard to compare plans plan to plan. Let me give you an example, and I'm going to talk from my perspective. I am a single employee. My out-of-pocket cost is $1,000 right now, and my max out-of-pocket is $3,000. And for those of you who don't know, I just recently had a knee replacement surgery, so I have maxed out my out-of-pocket contribution. Just as I'm sure Chief Brian will do, because he had a surgery. It only takes about one surgery only takes about one to make that happen. So the way our system works, $1,000 deductible, 80%, the insurance pays, we pay 20% until we reach our out-of-pocket max, which was for me $3,000. Okay, that's fine. Now, how do I compare that to the state? Well, first, the state's deductible for me is only $500. The state's max out of pocket, however, is $3,600. So I'm on the hook for $600 more, but they're going to pay 90/10 instead of 80/20. So it's going to take me a lot longer to get there to my max out of pocket with the state than it will on our plan. About double, actually. So how do you measure those? You know, for Mike and I, we both had surgeries. We maxed out of pocket. It doesn't really matter at this point. We're now free and clear. For somebody who's been going to the doctors over a little bit over the years, over the months, they may be halfway there or not even close to there. Who knows if you're going to even get there by the end of the year? So what can we do to solve it? Well, first of all, we are going to fund all of your cost that you have had up to this year that you've paid for towards your deductibles and all of that, okay? Now, if you haven't met your minimum deductible, we're not paying that, right? But if you've met your minimum deductible, we're going to pay that. You're going to start over on July 1st, and that's a pain. After this year, it'll be a whole year again. But we will fund that on a reimbursement basis. So when I go to PT in July, hopefully not, but if they said if I have to go to PT in July and they say here's your bill of $65, I bring it in and somebody in finance or HR or whatever will get me a check or whatever for my $65 because I'm starting to build my cost back into the state system. We're also going, now that's a 1 year time only because after this you'll have a full 12 months to do your deductible like you were supposed to have on this plan, on the original plan. In addition to that, we're going to protect you from the downsides of your max out of pockets. So if your max out of pocket is $3,000 and now on the state it's $3,600, we're going to cover 100% of that $600 this year. We'll cover $400 next year, $200 in the third year, and finally on the end of the year, the fourth year, you'll be on your own back at the full max out of pocket. Your premiums are basically going to be the same as what you are paying now as a percentage, but the rates are lower or equal to. So the range of what you're going to pay is somewhere between nothing different and a 27% decrease. So it all depends. The state prices things differently. For instance, those of you who are just married and spouse, you're going to see no change in your rate at all. If you're a family, you're going to see a big decrease in most plans. Okay, so employees pay nothing anyway, so it's really hard to get much lower than 0%. All right. They have the same plans, local access, open access. Some of you have chosen the open access plan. That is still your choice. Those exist in the state plan. My recommendation to you is to think long and hard about why you have open access. If you have it because you travel a lot, don't worry about it. Because if you're traveling, then the network will be adjusted for your location. If you are local, however, and you want to use the doctors and or the services at TriStar, you do need to be in the open access plan. Now, if you need to go to the open access, to TriStar because it is an emergency and it is a life-saving emergency and that's your closest hospital, go. You will be in network. If you go there because you have a sunburn or your kid's throwing up or something like that that is not a life-threatening emergency, TriStar is out of network on the local plan, but in network on the open access plan. All right? So that is your choice, your decision to make. Here's the deal. There's 16 choices for you to choose from. Okay? And when you multiply that by 4, employee with child, employee, spouse, and family, that's 64 different variables that we're trying to control for. So please forgive us if we don't know the answer to your particular question off the hook, because I don't have all 64 of them memorized. Are you coming in, ma'am? Nope. Okay. So anyway, we're going to do our best to make this as easy as possible, but I can promise you this is not without pain. Nobody said this was going to be easy. There's several other things going on in the organization, and they're not easy either, and we're all kind of stepping up and taking a big one to get to the other side, knowing that it'll be a better day when we do. You're going to have to re-get authorization for your prescriptions. You may have to get surgeries that are scheduled, reauthorized, blah, blah, and blah, okay? We know there's some pain to it. Now you're going to have to keep up with your receipts if you want reimbursed and bring them into City Hall, whereas before you didn't have to worry about it. So here's the silver lining. Number 1, you're getting at least as good, if not a better, health plan. And number 2, we're raising the dental from $1,000 a year to $2,500 a year at no cost to you in the first year. So that's the gift we're giving you for putting up in the hassle. Okay? Hopefully you'll appreciate it. None of the other benefits are changing. They're all staying the same. So with that, I think I've given you all the confusion I can give you, and I'm going to leave it to other people.
Well, good evening, everyone. For those of you I have not had an opportunity to meet, I'm Richard Stokes. I'm your HR director, and I'd like to talk with you about the enrollment process ahead as we transition to the state of Tennessee's Partners for Health plan. Many of you are attending listening sessions today. Some people will be attending tomorrow. Others will view this presentation via video from the comfort of their homes with their families. I cannot stress how important it is for you to understand the enrollment process and get the necessary paperwork collected and turned in on time. Part of this process involves individual meetings with employees to review your options. This is your opportunity to sit down with highly trained benefits counselors who can guide you through enrollment, help you understand your benefit package as a whole, and assist you with making decisions with your benefit enrollment. American Fidelity benefit counselors are joining us to help us educate, assist, and serve you in this process. Additionally, The jury group, who has been a part of our open enrollments for the past 12 years, will also be working with us. All employees will need to meet with an advisor to complete the enrollment or opt out, all right? Everyone must meet with the advisor. Even if you're opting out, even if you have coverage through your spouse or some other place, you still need to meet and fill out the forms that say you're opting out, okay? And in addition to that, you will need to provide verification that you have insurance somewhere else, all right? So if you're using your spouse's insurance, you've got to make sure you show us that you are on your spouse's plan. Okay, a new orientation package is available, and we have it back in the back. That is this document. This document provides an overview of premiums and deductibles, network plans, pharmacy costs, employee assistance programs, local consumer-driven health plans with health savings accounts, behavioral health, and carrier information. More detailed information about enrollment and your benefits can be found in the eligibility and enrollment guide on the Partners for Health website. We did not provide you with a copy of that because that is a 38-page document, and Trish would still be making copies. Oh, you all should have a copy in your email when you get home. We emailed them out, so you will have that 38-page document also. More detailed information, well, I just mentioned that. You will be provided with an employee checklist to confirm that you have received this important benefit information. That is another document that you should have picked up on the front and the back table. This is the checklist. It's a one-page. It's basically everything that should be covered in our meetings, both here and individually, all right? These documents must be signed and must be returned to HR, all right? After the presentation, again, we need these forms back. If you can, fill them out before you leave and turn them in, that's fine, or you can send them back to HR. Again, I want to remind you that you will have to verify your spousal insurance, but also you will need to verify your relationships. If you are going on the family plan, you're going to have to verify your spouse and your dependents. There is another form, the application form, that you should have also picked up. On the second page of this form is a list of the documents that you will need or you can use in order to verify spousal relationships and your dependent children. That also includes if you have adopted children or if you are a foster parent or something, you need to have documentation to show all of that. And all of that must be submitted with this application, all right? Once enrollment is complete, insurance cards will be mailed out within 2 to 3 weeks after the application is processed. For Blue Cross and Blue Shields, you'll get 2 ID cards. The member's name will be printed on all cards, but these cards may be used by any covered dependent. Cigna enrollees will get separate ID cards for each insured family member with the participant's name printed on them. You will also receive a separate CVS Caremark pharmacy ID card. If you're enrolled in family coverage, your ID card may be sent, ID cards for each may be sent in separate envelopes. Optum will mail ID cards for behavioral health and substance use. If you need more help, please do not hesitate to contact us in HR, or you can reach out to the state's Benefit Administration Office. That number is 800-253-9981. And their office hours are Monday through Friday, 8 a.m. to 4:30 p.m. I'm sorry? The number again, 800-253-9981. All right. And with that, I would like to bring up some of the representatives from the state, then representatives from Blue Cross and Blue Shield, and then representatives from the Drury Group and American Fidelity. First, I'd like to ask Jessica Southern and Judy, if you would.
Okay, perfect. Yes. Well, I hope that's a new trend because it's just gotten worse. So, I mean, once you hit the bottom, there's nowhere else to go but up. So, I'm here for it. So, I'm Jessica Southern, and I'm the Outreach Director for Benefits Administration at the state of Tennessee. We administer the state group health insurance program that you guys are now joining. So, welcome the city of Spring Hill and all the departments and all the employees and your dependents. We're excited that you guys are joining our plan and that we can help you have some peace of mind and just live your best life, live a healthy life, right? And have lots of choices and lots of options. So I'll try to best explain those, but the best resource for you is going to be to check out our website. So you could pull it up from your phone. You don't have to have a login or any of that. It's all public information. It's right there, everything you need. It's tn.gov/partners with a S for health. So tn.gov/partners for health. When you get on our website, I'm going to try to give you a visual of this since you can't see my presentation. But there's several different tiles. You'll want to go to the local government tile. There will be a comparison chart. You can compare our plans side by side. I'm going to reference that quite a bit in our presentation today. And there will also be a for new employees tile. For the sake of you coming onto the state plan, you may have been employed for 30 years, but you are still a new employee coming onto the state plan. So you will go to that tile. We've already loaded in City of Spring Hill. There's a video there. There's a follow-along packet. And if you don't want to watch the whole video, fine. Skip ahead. It's a YouTube video. You can fast forward to the parts that are just relevant to you and your family. But really, at the end of the day, we just want to equip you, even if it's not via PowerPoint, ourselves and our carrier partners, and give you the tools and resources you need to make a good guided decision and help you as you navigate that for yourself and your family. Because although you currently have Cigna, we have Cigna options too, but we also have Blue Cross Blue Shield options, which may be new to some of you. We have 4 plan options, which will be new to all of you. So we'll walk through those and try to help you make the best decision you possibly can. So before we get into the nitty-gritty of our health plans, which I know is the reason why y'all all are here, but I wanted to cover quickly just some extras that come along with the health insurance plan that a lot of times you may not realize or think of. And these are some of the extras that are included, and these are all also on our website. But our EAP services are included. That encompasses things like adult and elder services, child and parenting services. A lot of times you don't think of consulting your health insurance provider or, not your provider, but your health insurance plan to help you find a daycare or to help you find financial aid resources to go back to school. But all these things are included free to you as a member of the state plan. Another thing that's included is legal consultation, mediation, and financial planning resources, which you guys know all 3 of those can be very costly. items, especially if you consult with a lawyer. There are certain stipulations, of course, but you get 2 free either phone calls or in-person visits with a lawyer regarding a legal matter. You get consults with a financial planner, and that's free of charge to you. There's also a lot of tools and resources on our website, on Blue Cross's website, on Cigna's website, that will help you navigate decisions as you choose doctors. Maybe you have a doctor that you love and that you've had for years and they're retiring and you have no idea who to go to, or you're wanting to check out a new center, or you're wanting to know how much a knee replacement costs. There's tools and resources out there that breaks it down, makes it very simple and easy to understand. And the other big thing that you will now receive as being members on the state plan is the state employee discount. So you guys will now get the same employee discounts that we get as state employees and that includes the big box retailers, right? Like Costco, Apple, Verizon. On your cell phone bill, you'll get a discount. If you buy a car, there's several participating dealerships that provide discounts to state employees, as well as local discounts like Dollywood and Tennessee State Parks. There's all kinds of stuff on there. You'll now have access to that, which is interesting because you don't really think about, oh, well, now I have health insurance through the state. Now I also have the state employee discount. So that's exciting. So getting into our health plans, there are 4 plan options. So the first choice you need to make is which plan you're going to take. There's 3 PPO plans, and then there's a high deductible plan with a health savings account. Okay? That's your first choice. Your PPO plans are a little different than a high deductible HSA plan in and of the fact that the 3 PPO plans utilize a copay when you make a visit, right? So you know when you go to the doctor, on that comparison chart I was talking about on our website where you can compare side by side, you can look at that chart and see, okay, if I make a preventive care visit, what am I going to pay? Well, if you go in network, you're not going to pay anything because there's no charge in network preventive care on all plans. But if you make a specialty visit, what is that going to cost? What is your copay going to be? If you have an emergency room visit, what is my deductible? What is my max out of pocket? All of that is listed on the chart and you can compare side by side. It's broken down. It's really easy. I wish you could see it visually, but you can see it on our website. But it breaks it down and it makes it easy to understand as you're navigating the decision of what plan is best for you. A PPO plan where you pay your typical copay, or a high deductible with a health savings account where, you don't have a copay when you go to make a visit. You have the percentage of coinsurance after the fact, right? And you have a higher deductible, but then you have your health savings account that you have funds on to help pay for these expenses as they arise. The 3 PPO plans are very similar, right? They're all PPO plans, but the difference is the deductibles are different, the max out of pocket is different, and then your premium, what you're paying out of your paycheck, is a little different. So the Premier PPO plan is the richest plan that we offer. It's going to be the most expensive out of your paycheck, but you're going to have lower costs throughout the year as associated with health care. Your standard and limited PPO is kind of the reverse of that. It's a little bit cheaper on your premiums each week, less out of your paycheck, but you're going to have to pay a little more as far as it relates to your health care and your visits. So really, you just need to decide what's kind of best for you and your family. Would you rather see that money coming out of your check on the front end, or would you rather kind of pay it on the back end? Like the limited PPO has lower premiums than all of the PPOs, but there's the maximum amount of out-of-pocket cost. Once you choose your plans, so your 4 plans, right? Your 3 PPO options and or your high deductible HSA plan, then you're going to have to choose, are you going to go with Blue Cross or are you going to go with Cigna? And the big deciding factor in that decision is what provider do you use, what hospitals do you go to, and we have all those resources available on our website. If you see a specialist now, you can type in their name and see on the carrier's website if they are in a certain network, because that leads me to the next choice. It's all about choice, right? We want to offer you a lot of choices, but it can be a little overwhelming. But the biggest thing is just that you make sure that all your doctors and all the hospitals that you go to now are in your network. So there's 4 networks, 2 local networks and 2 broad networks. So Blue Cross Blue Shield has 2 networks and Cigna has 2 networks. So once you decide, hey, I'm going to go with Blue Cross or I'm going to go with Cigna, you know, maybe checking out the networks may be how you decide who your carrier is going to be. But all those tools and resources are found on our website where you can go in and search and look at that. The big thing to note is if you're going, so the 4 networks, there's 2 local networks, which are smaller, so less providers, better negotiated costs, and then 2 broad networks, which are open access and network P for Blue Cross Blue Shield, and it's a broader network, bigger network, more providers, and a bigger cost. Okay, so there's a little bit of a surcharge for those 2 networks. So it's just important that you guys look and make sure. I will tell you this, on our local government plan as it stands today, 92% of our members that are currently enrolled have those local narrow networks, as we call them. It's a typical network most hospitals are in. I did pull Williamson County and Maury County, and Williamson County Medical Center is in both. Maury Regional Medical Center is in both. And if you travel to Nashville to get care, the big thing to note there, Vandy's covered, Ascension St. Thomas is covered, HCA Group is not covered. So TriStar facilities, so the TriStar Spring Hill ER is in the broad network. So if you get care on a regular basis from HCA, you would probably want to consider going with a broad network as opposed to, I don't like it either, but as opposed to the local narrow networks. So the big high level overview of the comparison of these 4 plans is, I mentioned it earlier, there is no charge on preventive care as long as you see an in-network provider on all 4 plans. The copay plans use a set dollar amount for things like office visits, prescription drugs, emergency room, urgent care. And then the local CDHP and HSA plan uses the percentage of coinsurance. So that's the big difference. But again, the chart will show you deductibles. The chart will show you max out-of-pockets. I had them up here for you to see, but that's okay. You can see all that on our website. So with that, I'm going to turn it over to Judy. She is going to come up and walk you through a successful enrollment and onboarding process.
Good evening, everyone. My name is Judy Carmen. I'm an education outreach specialist. I work under Jessica with the Department of Finance and Administration, Benefits Administration. So I wanted to go over some key components with everybody just to make sure that you have what you need so that way you're not missing anything, so you're not delaying your, oh, it works. Okay. Jessica, did you want to go back and show them anything that you talked about that you felt they needed to see?
You can go ahead and we'll just pull up the website.
Circle back? Okay. All right. So Jessica already covered the video as far as the new employee video. So just know that this is going to be a lot of information. And basically, if you want to go back and listen to the video, you can go ahead and pick your different sections. And then there's also a guide underneath the video when you click on it. So if you don't want to watch the video, just click on the link and it'll pop up a guide that you can, again, follow. Now, another key important thing that I do want everyone to be aware of, on the second page of the enrollment form that Richard pointed out earlier, you're going to see a list of who can be covered as far as spouses and children. This just has some of the children, but again, it's biological, adopted, stepchildren, or children you have court-ordered custody or guardianship. And to the far right of what's listed on the second page, you'll see the documents that we need in order to cover these dependents. Now, one thing I want to everyone to take note that's covering a spouse, you'll see that we need 2 proofs of dependence verification. So the proof of marriage is just a copy of your marriage certificate. But on the additional document, you'll see on the second page that there's a list of 6 things. It's like bulletin points. You just have to pick one document out of that list. You don't have to give us all the documents, just one thing. Also, with those documents, depending on what you pick, there's a certain time frame that you have to submit it. So, for instance, mortgage statement, credit card, bank, we need something within the last 6 months. Property taxes within the last year, or if you are using the first page of your tax return The latest we'll accept is 2021. I know it's kind of sensitive information, so you can black out your account numbers, financial information. All we're looking for is just both of your names and that it's the company logo, that it's a valid statement. So I just tell people Sharpie it out, photocopy it, and we just see what we need to see. We don't want to know how much you have in your bank or what your account number is. And if you have any questions or you're not sure, just ask the counselors that you're going to be working with. You can ask Richard or Tricia. They can shoot us an email, scan us a document, and we'll see if it's acceptable. Please note, no auto insurance, no utility bills. It's strictly the 6 things that are on the list. That's one of the biggest things that we always have to kick back when we're enrolling dependents. So I just wanted to make sure everyone is aware of it. Yes, so both names have to be on the document. We call the head of contract, which is the actual employee, and the spouses for the married employees that are adding spouses. I did have someone come up and ask about stepchildren. So the proof of marriage is just the marriage certificate again. And if the stepchild, as long as the birth certificate states the mother's name, like say it's the husband is employee and the stepchildren are the wife that he's now married, as long as the birth certificate says the mother's name that's on the birth certificate as stepchildren listed, you're fine. Like we'll do that paper trail. But yes, but all names have to be for the spouse on the secondary documents. So with the enrollment change application, Richard mentioned it earlier, but even if you are refusing, you still have to fill out an enrollment change application. You're going to put your information in part 2, which is just your HIPAA, so we know that it's you, so name, date of birth. And then in part 8, you're going to check off refuse, and then you're going to sign and date it. Basically, it's just putting you in the system, so that way if you decide you want to enroll the next open enrollment, or say you had insurance through your spouse and they lost their job, so now you can come in on the state plan as a special qualifying event. It's just so we know that you do qualify, but you just kind of refused it, but other things may come up where you can still get it later on. And then also for those that are enrolling in insurance, you want to make sure that everything is fully filled out, signed, boxes checked. The counselors will work with you, and I'm going to work with them tomorrow to make sure that everything is filled out correctly. Rachel and I, who's another E&O specialist, will be here June 1st as well. So after that session for that day, we're going to stay a little bit longer just to kind of scan, double check. If you guys have more questions past your, like what, if you've seen your counselor and you still have more questions, you can stop by and we'll help you out as well. But if you don't want to wait, just again, shoot Richard or Tricia an email and they can contact us, call us. We want to make sure that you are making an informed, confident decision. You know, it's your health insurance. You don't want to find out after the fact that it's not going to work for you. But the good news is with you guys coming in mid-year, that our open enrollment is in October. So if you pick something, it doesn't work, you need to change. Like say you were on the smaller network, but you go to HCA hospitals a lot, so you want to go to the broad network, you can just change it in October, and then the changes will go into effect January 1st, 2023. So you're not locked in forever. But just to make sure you have all the paperwork, because if we have to kick it back, it's going to delay your enrollment. You'll still go in July 1st, but you might not get your card. I mean, you can technically use it, but we'll have to give you your ID number. And if you go to the doctor's office, this is my ID number, I'm with Blue Cross, but they'll find you manually. So it's not the end of the world, but it's just easier to have everything all at once. But that is what I wanted to cover. So I'm going to, oh, sorry, go ahead.
Quick question, are we then moving from January to January instead of July to July? Like we had been?
Right, because you guys are just starting mid-year. So that's why, in a way, you kind of get a trial period. So instead of having to be locked in a full year, so if you find out, but that's why we're big on going on the website, just seeing who's in network, who's out of network, what would be a better option for you. And Jessica mentioned 92% of our employees pick the smaller networks. We were in City of Paris, some guy was like, I'm gonna pay that extra cost for the broader network. And when we looked up his providers, we're like, save your $65, all of your people are in the smaller network. So, but sometimes if you change specialist, you know, you don't plan to get sick, but if you have to go see someone and they're not in the smaller network, then you have to switch to make sure that your specialist is in their broader network. So it's stuff like that can happen as well, that you just may need to change based on your health needs. But since this now works, I'm going to bring Jessica back up here.
Well, sorry, you don't get to see it all, but I did want to show you guys the website quickly, because this will be your greatest tool. Oh, perfect, it's already on there. As you're navigating the decision. So if you go to tn.gov/partners for health, it's going to bring you to this page. This is the one that I tried to paint a picture for you in your minds that I didn't do a very good job of. But there's all these tiles, right? And so there's your for new employee tile. And we have already loaded in City of Spring Hill. So you'll just click local government, and then it's actually Spring Hill City of loaded in there. Very proper. Let's see here. Right there. And then you'll just click let's get started. Very easy, and it'll take you to all the resources you need just starting out and learning about our plans. However, this tool will kind of be one of the biggest deciding factors in how you choose your health plan. I know this is very small on a screen, but I did want to show you this, and I'll show you how to get to it as well. When you're on our homepage here, if you go down to local government agencies, this tab will have everything, this tile will have everything you need to know, and even some things you didn't want to know. You'll know way more about health insurance and healthcare than you ever cared or desired to know, but that's good. Informed decisions are the best ones. So this 2022 health plan comparison under new to the local government plan, that's where this chart can be found. And so this is what I was just telling you guys about. So it will take you line by line. So it'll have whatever type of service it is, right? So preventive care is on top. And then it breaks it down on 4 plans. So Premier, Standard, and of course to the side is Limited, and our HSA plan. And then it'll show you in-network and out-of-network. So no charge for preventive care. You're going to pay a $25 copay if you are on the Premier plan and you do a primary care office visit. That's not preventive, right? So this chart is really great. It takes you through side by side, very easy to digest and understand the information, especially when you can see it on your own computer and not on a screen where it's really tiny. But if you scroll down to page 2, it also has your deductibles there. You can compare, and your out-of-pocket maxes, which will help you as deciding factors as you're picking a plan. So with that, if you go back to our website, right, we're here. This is the homepage with all the tiles. If you go under health options and then health, it brings you to this page here with Blue Cross and Cigna. And this is where you can find all of your, under this carrier information tab, you can find your provider directories here, your hospital list, which is how I pulled you didn't get to see it. But that's how I pulled the information about the Williamson County hospitals and all that. And Nashville's on there. If you visit surrounding counties, it has every county in the state of Tennessee in that hospital list. You can look that up. You can do your provider directory. We recommend doing the provider search on the website versus the PDF because it does change. So the website has the most accurate information. But again, it also breaks it down by network so you can really make a good informed decision. Also, this is available for your prescriptions. If you want to know, yes, CVS Caremark is our PBM. They administer our pharmacy. They're our pharmacy benefits manager, right? But you don't have to go to a CVS. You can go to a Kroger. You can go to Walmart. And all that information is also on our website that you can peruse and see. You can actually put in how much is my prescription going to cost. There's local pharmacies that you can go to. And all of that can be found here as well. That's right. The networks is the biggest difference. So that's right. The plans are the same. Now there are some, they're going to get, Blue Cross Blue Shield and Cigna are going to come up and talk about some of their extras. They have some extra programs that are incorporated into their specific like carrier offerings. But as far as the plans are concerned, they're exactly the same. It's 3 PPO plans and the HSA plan, Blue Cross or Cigna. And with that, that's a great segue into Blue Cross. So I will let you take it from here.
Everybody love insurance? Well, thank you very much for having me. My name is Amy Jordan, and I'm with Blue Cross and Blue Shield of Tennessee. And everybody heard of Blue Cross? Good. So we are Blue Cross and Blue Shield partnered with the state of Tennessee health plan now for over 40 years. I feel like I've worked there and on the state plan for that long, but been with Blue Cross now 20 years, so half of that. So I just want to talk to you briefly about the networks. Now, everything about the networks that you've heard, you're talking about finding providers within the state of Tennessee. So within the boundaries, and some of those counties that hit the contiguous, some counties in Kentucky, some counties around in Alabama, they're going to be contiguous, so we do hold those contracts. So the narrow network that they're talking about for Blue Cross, you'll be looking for Network S, only if you're looking for providers within Tennessee. If you want the broad network, the larger network, the buy-up network, that's the P with Blue Cross. So it's Network S or Network P, and that's just in Tennessee. Yeah, I rhymed, so that's cute. Now, with Blue Cross, if you travel outside of the state or you have children or dependents on your plan that live in another state, it's going to be very easy to travel with Blue Cross. In fact, your ID card has a suitcase on it, and that means you can travel with ease. So what you're going to do, Blue Cross is in every state. We have a large network outside. You're going to be looking for the Blue Card PPO network. So S&P within Tennessee, Blue Card PPO is what you're looking for. Or like I like to say, you're in another state, you try to find a provider, you call them, you look on the website, you see that they're participating with the Blue Card network, or simply ask the question if you're at an urgent care, do you accept your local Blue Cross, your Florida Blue Cross? So we won't get into the nuances of how we make that work. Just know that you can travel with ease with Blue Cross, even with our global outside of the United States. We do have a network. But on the table, we want you to pick up, this is your plan, your choice for 2022. It's going to give you a very brief, high level of a guide of that we're more than just another health insurance company. We have been around within Tennessee for many, many years. I've already gone over the Network S and the Network P. So we give you some suggestions here on page 2. Make a list of your providers and everybody that you're going to cover. Make sure that you've got those pediatricians in the network. Start with Network S after you make a list, the narrow network. If you see them there, why buy up? Because again, if you travel and have to go to specialists, say MD Anderson for some reason in Texas, then you know that they're going to be part of that national large network. And then you're going to compare the premiums of what it will be out of your paychecks, and that's where Richard and team here and the state folks will guide you through those decisions, because again, the insurance companies are just here, Cigna and Blue Cross, to talk about what you get with the networks and some extras that you get for free. So, extras that make a big impact in the brochure. Jessica talked about the state discounts. Well, in addition to that, if you come with Blue Cross, you will also get discounts for being a member. So that's under our Blue 365 discounts. And within those discounts, things like LASIK surgery that might not be covered on the insurance plan, but through the discount program, you could go and get a discount in addition to that. So under the member discounts, we also have a Fitness Your Way. Now those are for gyms and fitness centers across the nation. It's not just in Tennessee. So for $19 a month, you can enroll and you get another card to keep it with. But then you can scan at one fitness center if you like their yoga class, but then you want to go to another fitness center for their weights or a particular other class or something jazzercise, who knows. But you can move around with it, and if you go to Florida on vacation, you can put in the search, like you're searching for a provider, you can search for fitness centers and get your workout on while you're on vacation. You will also get, if you come with Blue Cross, free identity protection, so you can opt into that at no cost to you. We have a recent redesigned mobile app. You can download the mobile app and take it with you. We have telehealth that is, our program is called Physician Now. It's powered by MD Live, and for a lower cost with the state, it's $15 for a sick visit on the PPO plans. And I think the negotiated rate now on the high deductible is a 40, I think it's 40 or 45. So you're going to pay a lower cost than if you had to go, and you can stay home and have those visits telephonically. And then we also offer a diabetes prevention program with our partners Livongo that I have this sheet on the back table there to talk about more, and I encourage you to check and see about it. Now, there is a QR code on here. You can shoot this and go directly to our dedicated member website to get more information just specifically for Blue, but I do encourage you to utilize that Partners for Health. It's got everything out there, and you can launch to our website from there. New in 2022 that we just rolled out March of this year is a second medical opinion for if you or a loved one on the plan have been unfortunately diagnosed with a very complex case. This is going to give you and your physician an opportunity to talk with experts across the nation, those MD Andersons of the world, Duke University. You can connect with those physicians telephonically just for those specialized services. So we've got more to come with Cigna. Any questions for Blue Cross specifically? And if not, I will be here after for some sidebars if you'd like. Thank you.
Hey, good evening, everybody. It's good to be here. Thanks for having us. I wanted to talk to you a little bit. My name is Cindy Saxton. I'm with Cigna Healthcare, and thank you for attending the meeting tonight. I wanted to talk to you a little bit about the Local Plus network and about the Open Access Plus network that's available to you with Cigna, which I know you already have. So it's going to work exactly the same. It's the same Local Plus that you currently have. Whether you're at home or away from home, the state of Tennessee, the Local Plus network has a large network of providers in the state of Tennessee, just like you're accessing today. When you're away from home and you need care, you look for a Local Plus provider. If you're out of state, though, you can either call the number on your ID card to have someone assist you or go to an in-network provider, or you can use your phone and the mobile app when you're outside. Or the other option is there is away from home care, especially when you're out of state. When you're in the state of Tennessee, and in this area, Vanderbilt's in network, Ascension St. Thomas is in network, and the Local Plus plan, or in the Local Plus network. If you go out of network, though, and I'm not talking about away from home care, but if you are out of network, you're going to pay more money out of your pocket for care. Here in this area, I did check, and Williamson Medical Center is in Local Plus, and so is Maury Regional Hospital, and then Vanderbilt and St. Thomas Ascension. On the Open Access Plus network, Open Access is our largest network that we have. You know that probably now because you have that available. And it does include the TriStar hospitals, as well as Vanderbilt and Ascension St. Thomas in the Nashville area, Williamson Medical Center here, and Maury Regional. And like I said, it is a national network, and it is available to you as well. But if you go out of network and you're in the Open Access Plus, it's going to cost you more out of pocket. I always try to make sure everybody knows when going out of network, you're going to pay more money out of your pocket. If you do choose Cigna, you know you have the mycigna.com, and I feel like that is one of my best friends because you can, if you're at a doctor's office and you're being referred, like from your PCP or your nurse practitioner, maybe you're being referred for a specialty, you can have your mobile app with you, pull up MyCigna, and make sure that that provider is in the network. And it works, the mobile app works exactly like you're logging into your computer. You use your same user ID and password. You also have access to 24 Health Information Line. It's available through Cigna, and that is access to a registered nurse on the phone and health information line. We speak various languages. It is accessible for the hearing impaired also. And there are podcast and audio health information available online. You also have available the Health Rewards, which is a discount program. It's not a coverage program, it is just discounts. And it's available through Cigna. And those are discounts for fitness, weight management, nutrition, tobacco cessation, vision and hearing, alternative medicine, and healthy lifestyles. Like I said, this is not a coverage type thing, but it is a discount program. And I've gotten like a Sonicare toothbrush through Health Rewards, but there are various other type things that you can order as well. Our virtual medical is through MD Live. Some of you may have already used MD Live through Cigna, and it is our physicians with MD Live are board certified. We also have pediatricians that are available through MD Live, and they can diagnose and prescribe medications for minor conditions such as allergies, asthma, bronchitis, colds, flu, earaches, fever. I logged in to MD Live early during the pandemic. I was not well. I didn't have a fever though, and they just diagnosed me with a sinus infection that time. And he called me in a prescription. I could see the doctor's head from here up. I never got to see much of his eyes or any part down here. It was kind of a funny visit actually to me. But anyway, the last time I called in was a little over a month ago on MD Live, and I did a phone visit with this doctor. And I actually had COVID, and I tested positive with a home test. And they called me in a prescription that way. So I had never used it up until 2 years ago, but I love it now, so I will continue to use it when I need it. You also have the Omada. It is our diabetes prevention program. If you are already diabetic, it would not be available to you. But if you are in a pre-diabetes area, like if you go into your doctor and they diagnose you pre-diabetes, or you can just go out online and answer questions with Omada, and it will either tell you that program is available to you. You can do that, and they will mail you a scale which connects with Omada, and it is a fabulous program. I've gone through it for 2 years. I liked it. I had a coach using that program, and they helped me with various, with my diet, helped me decide what I needed to cut out of my diet, what I needed to reduce on my diet, the things that I needed to increase on my diet. So I think that is a really, really good program. And I also brought with me, and I forgot to show you these, I brought Local Plus and a flyer on Open Access Plus. So those are back there on the table. I also brought something on the bone and joint health benefit, and it's on the table as well, and then on our virtual care. But the bone and joint program is available, and it's to access select group of in-network providers for bone and joint health. And some of the procedures are like a low back disc surgery, hip replacement, knee replacement, spinal fusion, and it's like a travel benefit that comes with that program if you're traveling over 60 miles. And the beauty of this plan is if you're in the PPO program or the PPO plan, the services are at 100%. If you're in the CDHP plan, you do have to pay your deductible first, and that is for the surgery and the imaging and things like that while you are in the hospital. The pre-test things like that you might have a month before would not be included in that 100%, but while you are in in the hospital, the pre-op testing, the day of surgery, those type things are at the 100%. And so I think that is one of the beauties of that program. You also have available the Consumer Medical Expert Medical Opinion Program for all health conditions. It includes cancer, cardiology, musculoskeletal conditions, and the team will check and credential, make sure your doctor has and verifies the skills to help you have a surgery or something like that you are being treated for. I like that program. I don't have that program. I have not used it for a surgery, but it will help you with your options too, like maybe for physical therapy or whatever. The last thing I wanted to just call out is the Cigna phone number that will be on the back side of your ID card, because this will be different than the ID card that you have now. You'll get a different ID card, but the Cigna number on the back side of your card will be different than it is today. And because the number that you will have on this card, being on the State of Tennessee plan, is totally designated for the State of Tennessee, and it's 1-800-997-1617. We're open 24/7, 365 days a year. I don't work those hours, but we have people that are available during that time. But anyway, when you get your new card, make sure you start using it as of July 1. Thank you. And does anybody have any questions for Cigna? Yes, sir. They would be the same as the 15 or 40, 45. Yeah. Anything else? Yes. Yes, it is. Yeah, it's Active and Fit is our gym membership programs, and you don't have to go use the same gym all the time. It's like you can go to different ones. Any other questions? Thank you.
Good evening, everyone. My name is Mike Henson. I'm with the Drury Group, and as Richard mentioned earlier, we've been working with the city for 12 years now on their benefit plans, and we're going to continue to do so. My portion is going to be brief. I'm going to talk about the other plans: dental, vision, disability, life insurance. The good thing there is, and why it will be brief, is there's no changes. Which is a good thing. Your plans are going to stay the same, your rates are the same, so no rate increases. I do want to touch on the dental. As Pam mentioned before, the dental plan will be enhanced. The increase in the annual maximum going from $1,000 annual maximum to $2,500. What the annual maximum is that is the amount of coverage that is paid out by the provider. And your provider will continue to be Cigna. So if you have dental work done during the year, you hit $1,000, then it's over. But now that's been increased to $2,500. If you have already met your maximum for the year, any services that you have after July the 1st, you will have another $1,500. So it will be, again, a total of $2,500. So that's great news, enhancement on that. Also, in addition to just the regular annual maximum, you also have an increase in the orthodontic annual maximum, or it's actually a lifetime maximum. So if you have children that are currently going through getting braces, or you're going to have children that are going to be getting braces, that maximum is going from $1,000 to $2,500, and that's great news. And again, the cost is going to stay the same. The city does pay 100% for the employee-only cost. The employee does contribute if you have family members, but that cost is not going up, even though you're getting a better plan. The other plans, vision insurance, your short-term disability, long-term disability, you have basic life insurance that the city pays 100% for, that covers all employees. And then you also have voluntary life insurance. So you can get additional life insurance. A lot of you may have already enrolled in that. This open enrollment gives you the opportunity, if you don't have additional life insurance, you can sign up for additional. If you already have the additional voluntary life and you want to increase it, now's the time to do that. Any of those plans that you do not are currently enrolled, vision or the short-term disability, again, now's the time to enroll in those. But if you're in them now, or if you do not want to enroll, then there's no changes to be made, which that's great news. You got a lot of changes going on with your health plan, a lot of good changes there. So it's good to know that your other benefits are going to stay the same, with the exception of the enhancement of the dental plan. One other thing that I'll touch on is the AFLAC plans. You have opportunity there to participate in AFLAC plans. They've been here for several years. Beginning July the 1st, the offering of the AFLAC plans will no longer continue. If you have AFLAC policies now, they're going to continue. You're going to continue to have those payroll deducted. You're not losing your AFLAC plans, but any new plans will not be offered. American Fidelity, who is helping out with the enrollment counselors, they're going to be offering some of those plans in lieu of or in place of the AFLAC. They're going to be speaking about those here briefly. But when you sit down with the enrollment counselors, they'll be able to tell you more about those. But again, if you have AFLAC currently, don't think that you're losing it. You're not. You can still continue your policies, and they will continue to be payroll deducted. If you need to make any changes to your AFLAC plan, if you currently have it, then let the enrollment counselor know that you need to actually see one of us at the Drury Group, or just let HR know that you need to make any changes in AFLAC, and we'll help you out with that. Any questions? Okay. Thank you all for coming this evening, and we'll see you during the open enrollment period. One other thing I'll say is that when you meet with the enrollment counselors, they're also going to be talking not only about the health insurance and the ways you sign up for that, but all of the other plans, dental, vision, life insurance, they're all going to be on that same enrollment platform. So when you sit down with them, they're going to show you what you currently are enrolled in, and if you want to enroll in any plans or make changes, you're going to do that with other benefits as well. Anything? Thank you all very much.
Hello, everybody. We're about done for the day. Who's ready for this day to be over? I think I saw every hand in the room go up. And sometimes it's a good thing to be last. Okay, Richard, I know you'd agree with that, right? Okay. All right, y'all thinking, who is this crazy lady up here? We're ready to get out. My name is Melanie Sly. I'm with, thank you. Melanie Sly. I'm with American Fidelity. Thank you, Mike, for the intro on what we're doing. We are just really excited about having the opportunity to partner with the city of Spring Hill. You know, we do a lot with local government. A lot of what we do is because of our partnerships with, what is it, Ariel, over 6,000 nationwide. I'm here with my colleague, Ariel Brewer. She's in the back. She'll be helping me tomorrow. And we do function as benefit counselors, which means that we're here not just to help the city administer their plans, but we're here to provide education and support, especially with the changes that you're going through with your medical. It's a lot to wrap your head around. I mean, there's just no way around it. What I will tell you is that you'll be, I think, very pleased once you get through the process and realize, I mean, especially again with family plan, I mean, you're going to be saving money. And that's a good thing this day and time, right? Okay, who wants to save money? Absolutely, okay. So we will be talking you through every part of the process. Tomorrow it's me and Ariel. I will have reinforcements here to help me after that. So, it's going to be a work in progress, okay? But again, we're here to be supportive of you all and to provide you the assistance that you need. And if we don't have the answers, we'll get it for you, okay, as a short version. We will be providing the supplemental coverage for those that it's a good fit for them in their family. We'll help you find the right fit for you product-wise, price point-wise. That's always a consideration. It's a very individualized approach, whether you're looking for accident coverage, you're looking for cancer coverage, critical illness coverage, which, it's going to be different than what you've had before. So we'll talk you through that, and just know that talking is free. There's no obligation whatsoever. We want to make sure that you all are covered to the extent that you want to be, and that you have a full understanding of what you're eligible for, because that's part of what you work for, right? Okay? It's part of what I work for, I know. Now, I'm not sure about Richard, but I think it's what we all work for. So we're looking forward to working with you. What I'll do is take any questions that you may have that would benefit the group. If not, we'll be meeting individually, and of course, we can handle personal situations then. But anything that would benefit the group at this time? If not, thank you, Tricia. I had this right in front of me, and I completely forgot. This sheet that you have, and I can thank Ariel for helping me with this, so y'all tell her a big thank you tomorrow when you see her, okay? On the back is a QR code, okay, that this is the easiest way for you to set up specific times with us, okay? Now, we've got it set it up on 30-minute intervals to give us plenty of time. That does not mean that you have to spend 30 minutes with us, okay? It just means that time is allotted for you. And we're doing it this way so that we can maximize the potential and minimize the distraction and the time away from work, and just trying to keep it as hassle-free as possible, okay? But if you will use this QR code, it will take you directly to where you can select a time that is ideal for you. If you don't see what you need, or if there is an isolated incident that you need after hours, just let us know. We'll work through it, okay? This is my name here on the back. No, I'm not in Oklahoma City. That is home office for American Fidelity, okay? I'm based in Franklin, okay? So I'm not exactly local, but close. Okay, so again, just proud to be working with you, and I'll take any questions if you have it. If not, we can bid you a good night and see you tomorrow. Any questions? It won't let you do it. And to explain why it won't let you, that's above my pay grade, I'm afraid. But, and there will be more availability for next week, where I'm focused opening it up just for the next couple of days, okay? Because we really do want to minimize the disruption. I know the department heads appreciate that, y'all appreciate that. It just keeps it rolling a little bit easier. Tomorrow will be the first day. A lot of times the first day, it could be a few things to work out. So if that happens,
All right, I'd like to thank you all for coming out, and I want to encourage you, please schedule your appointments. You must meet with a counselor. You must fill out the forms, the application. If you do not fill out the application, you will not have health insurance. All right? All right, you guys have a good rest of the evening, and hopefully we'll get you scheduled soon.